Hello, my name is Bo Davis, and I'm a sophomore here, a part of the sports medicine program at Southern Miss.
Hey, my name's Connor Mozee. I'm a junior who's also a part of the sports medicine program at Southern Miss.
We will be explaining what a floating elbow is and why y'all have probably never heard of it. A floating elbow is a high trauma injury that usually happens all throughout the arm. You have fractures on your forearm bones and your humerus, which results in severe instability in the arm. And usually many bones are fractured as a result of a floating elbow.
The floating elbows are different and rare from most other elbow injuries. In fact, the humerus and forearm bones are fractured. This causes severe instability in the elbow. Usually the injury is caused by a high impact injury in the ever so common Fuchs mechanism. While the injury is very uncommon, children and adults, males are more likely to experience this injury due to the being of a high impact trauma injury.
When examining a floating elbow injury, you will notice how deformed the arm is. This is because your radius, ulna, and humerus are all fractured due to that high impact injury. This is a very serious injury, of course. It can be an open wound or a closed wound. And there's also nerve damage that can be a part, which is very serious, right? Surgery is the main treatment for this injury. Surgeons will go in, put plates and screws all throughout the arm so that your bones can grow together and not stop growing, which is a common term. But, it's you put screws and plates in and it helps it grow together. And also physical therapy is also something that is very commonly needed for this, as with a big, high traumatic injury like this, many muscles will be affected. So you need physical therapy to really help regain that muscular strength and nerve strength.
For our case study, we did a 64-year-old female who attended the ER after a fall of at least 3 meters. From the patient's history, it was clear that she had fallen off a ladder on her left palm with elbow extended and on approximately 90 degrees of abduction. After examination, it was revealed that the upper limb was swollen but had no contusions and neurovascular damage. X-rays showed a short oblique fracture of the mid-shaft of the humerus, then a posterior lateral dislocation of the elbow and mid-shaft fracture of the ulna. The patient underwent reduction of the elbow dislocation, followed by a closed reduction and internal fixation of the humeral shaft.
In sports, this is not really likely to happen, though it can happen. When you're playing sports, injuries can always happen, no matter the injury. This has to be a very high trauma injury, so maybe like a big hit in sports or something, or maybe a very severe Fuchs injury where you have a lot of weight coming down on the arm can make this happen. It's highly unlikely, but there's always a possibility. This injury is extremely traumatic to the fact where, if this did happen, this could end a career. Usually in athletes, 61% of floating elbow injuries have non-union cases reported, which is where the bone does not grow or heal like it's supposed to, right? And when you're especially in a throwing sport or anything of that nature, that's not good, as you want your arm to get back to where it was. And, that can cause severe instability, and you can just not get back to what you were. But again, this causes fractures all throughout the arm, so it'd take a whole lot of time to recover. And again, it is very unlikely to happen, but it also, if it did happen, it would be very hard to get back to the strength you once were in that arm.